New data shows that more than 100,000 drug overdose deaths in the U.S. from April of 2020 to April of 2021, a 28.5% increase from the year before. Overdose deaths from opioids climbed past 75,000. KPIX 5 reporter Wilson Walker joins us live in San Francisco with details on what's behind this recent spike. Wilson?
Yeah, Liz, here in the Tenderloin, which is obviously the epicenter of San Francisco's overdose crisis, but you don't get to the number that America's looking at now, 100,000 overdose deaths in 1 year. You don't get to that number without a problem unfolding in many different places in many different ways.
What's been extraordinarily frustrating for me, working in the Tenderloin, is seeing the city just allowing open drug supermarkets throughout the neighborhood, and then bemoaning that there's all these overdoses in the Tenderloin.
As the nation's overdose numbers soared, neighborhoods like the Tenderloin became the front lines of the disaster, prompting debates over law enforcement and safe injection sites. But in 2021, San Francisco's overdose numbers are actually on pace to decline. This is a problem larger than one neighborhood or one city.
As an emergency physician, I would see patients come in. You couldn't tell what was going on. They had an altered mental status of some kind, and you couldn't tell, is this a stroke?
Dr. Jasper Schmidt is an emergency physician in Sonoma County, where patients, often older, he says, suddenly started showing up with multiple drugs in their system.
You know, combined overdoses that, really were a sign that a lot of use had, the source of drugs had really changed for a lot of people during COVID to underground sources.
The opioid crisis started in the 90s with Purdue Pharma, and now it has mutated to encompass heroin, to encompass fentanyls. And we took a long time getting into this, and very sadly, it's going to take a long time to get out of it.
Keith Humphreys is an addiction researcher with Stanford University. He says the growing death toll is a sign that this is not a temporary crisis, but a long-term health emergency for the country.
So we have to start thinking about addiction and overdose like we think about COVID. When COVID happened, there was a national sense that this was hugely important, that it needed a lot of resources in terms of health services, information, research, all those things. And we've never really done that with addiction.
One of the examples that's getting thrown around as something that's working is that a lot of emergency rooms now, including San Francisco, have someone stationed in the emergency room. So when someone comes in that survives an overdose, they are immediately met with some offers for services and some help to get out of addiction. Now back to San Francisco's numbers. The number was over 700 overdose deaths in the city last year, Liz, and it looks like the city is sort of on track for maybe a little over 600 this year. So it'd be a significant drop. Still a high number, of course, in the city, but trending down a little bit.
Trending down. It is positive, although it is still a horrible crisis out there. All right, Wilson, thank you.